Joining me now is Republican Senator John Barrasso of Wyoming, who is the chairman of the Republican Policy Committee. Senator, thank you very much for joining us. I do want to start, if you don't mind, with North Korea. The president today talked about attacking North Korea. Tell me, what's the GOP Republican responsibility in Congress to, mitigate the presidential's war powers?
Well, I think the president was very forceful. He puts the United States first, wants to work with our allies, talked about that with regard to China, with regard to Russia. There is more that China can do in terms of cutting off fuel, oil supplies to North Korea. Talked about our partnership, and we have those in Japan and in South Korea. We may get to a point where we're going to have nuclear weapons there as a deterrent, but we are sending a strong message to North Korea that what this young leader is trying to do will not stand with us or on the world stage.
What about the war powers, though, for Congress? If the president does decide to attack that country, what's the GOP Congress's role?
Well, I support the president if that's his choice. It's not our first choice. The first choice is diplomacy, but I think the president has the authority and will use it if necessary to do the kind of attack that he has described. I don't think that's his first choice. It's certainly not the first choice of anyone. But North Korea continuing to threaten the homeland, the safety and the security of the American people, and we've seen the advances of the technology in North Korea remains to be very worrisome for us tonight.
Let's move on to health care. At this moment, there are about 50 votes for the Graham-Cassidy bill. Well, it's not clear, though, if there is going to be enough to get this thing passed. If it turns out that Senators Murkowski or Lee or McCain do not vote yes for this, should they be primaried?
Well, some of those senators just got reelected in November, so you're talking a long way away, 6 years from now. The bottom line is Obamacare continues to fail the American people. I heard it at home again this past weekend in Wyoming. Across the country, costs are going up even more next year. The Republicans are looking to get the decisions and the money out of Washington back to the states, where as a doctor and as a former state senator, I can tell you the money could much better be spent. Right now, 40% of all the Obamacare money goes to just 4 states, California, New York, Massachusetts, and Maryland. That's just 20% of the people of the country. So there is this huge disproportion in where the money goes. I just have much more confidence in people at home making decisions, not Washington, D.C., trying to decide what's best for everyone at home.
So are there 50 votes for this?
Well, we have another week and a half to make that final vote. It will be easy to get it to the floor. We're working with each and every one of the members. So many of the members want to get to yes because we know that Obamacare has failed. We know that the Democrats in the House, the majority of the Democrats in the House have sponsored a program which is a complete government takeover of health care. We know the litmus test for the liberal left in the Senate and those wanting to run for president as Democrats in 2020 is for a complete government takeover of health care. It's the Bernie Sanders plan, which is something that I believe will lead to rationing of care, limited care, and huge increases in taxes on all Americans, and I'm doing everything I can to prevent that.
I'll hold that thought on Bernie Sanders' plan. It sounds like you're saying right now that as of now there are not 50 votes for this, but you also talk about giving the states power back. A number of governors say that they don't want this bill, and they're urging their senators not to say yes to it. 10 governors, 5 Democrats and 4 Republicans say this is not the right idea. That's a number of states who say that they should not have the powers that the Graham-Cassidy bill will be putting forward.
Well, each governor gets to decide what they think is best. I'd ask them to understand it first, and I can understand if you're a governor from those 4 states that get 40% of the money and is only 20% of the population, that they wouldn't be happy about this.
This is 10 governors from 10 states.
I understand. And many of those are in states that expanded Medicaid, which is a program that has now failed as a result of the expansion specifically related to the fact that people that Medicaid was designed for initially have been lost and left behind because of all these additional people put
There's
on Medicaid.
widespread popularity for Medicaid right now. Medicaid seems to be the only thing that is working.
Well, I'm going to disagree with you on that.
About the
Katie, no, there's not widespread popularity for Medicaid. We know that 1 out of 3 doctors won't take new Medicaid patients. We know that it's harder for people with Medicaid to get care. We know that their results of treatment are worse. There is not widespread popularity. There's widespread popularity by certain governors to take the money from Washington for the expansion of Medicaid, but for the patients who are actually on Medicaid, and I'm a doctor, I was in my medical office last weekend in Wyoming, I will tell you, Medicaid continues to have failed the American people, and the expansion of Medicaid has made it worse for people that Medicaid was originally designed for. The low-income women,
Senator,
the children, and the disabled, they have been left behind as a result of so many people being jammed onto Medicaid, which is why it's harder for doctors to take care of them.
The majority of the people in this country have favorable views, are favored toward Obamacare. They have not been favored toward anything that the Republicans have put forward so far in Congress. I want to talk about essential health care benefits. There are not protections for essential health care benefits in this bill.
And there shouldn't be. There shouldn't be.
Can you assure people of Wyoming that they're not going to lose their health care because of a pre-existing condition?
Those are two entirely different things. This bill protects everyone with a pre-existing condition. My wife's a breast cancer survivor.
Can you assure that their costs are not going to go up? She's been through
chemotherapy twice, been through radiation. Well, can you keep interrupting if you'd like? I'm trying to answer your first question. The essential benefits was the Obama approach that said you have to buy all of these different kinds of health insurance, a lot of which you don't need, can't afford, don't want, isn't right for you and your family. But President Obama said he knew better for you than you knew about you and your family. It's the #1 complaint I get in Wyoming. The costs have gone up so much because people had to buy insurance they didn't want, didn't need, and can't afford. I want states to have the option to opt out of the essential benefits. I believe people with pre-existing conditions need to be covered for those conditions. As a doctor and a husband of a wife who's had breast cancer, I am committed to that.
Senator, I just want to know one thing. Can you guarantee the people of Wyoming that the costs associated with their pre-existing conditions will not go up so much so that they will not be able to afford it?
The costs have gone up already under Obamacare, Katie, so much that people can't afford it.
I'm not talking about Obamacare. I'm asking this for Graham Cassidy, which is something that you're going to be voting for. So I'm just asking you,
more money is going to come into Wyoming as a result of Graham Cassidy. More money is going to come in. When you have people that can't afford their policies, which is what I heard about this weekend, we're down to 1 insurance cover under Obamacare. Only 1 is selling insurance in Wyoming.
I'm just trying to get you to answer the question that I asked, which is, can you guarantee the people of Wyoming, let me finish my question, and then you can answer it. I'm not talking about Obamacare. I'm talking about Graham Cassidy.
Well, you should, because it's failed.
Respectfully, this is the bill that you are voting for. This is the bill that your constituents, the people of Wyoming and the people of America, will use for their health care if they don't get it through their employer. So can you tell,
better off.
Let me finish. Can you tell your voters, the people of Wyoming, that the costs associated with their pre-existing condition will not go up so much that they will not be able to afford health care coverage?
People can't afford it now, Katie.
That's
I don't
not
understand
what
you
I
don't
asked,
understand.
Senator.
If they can't afford it now, we're trying to get more people able to afford it, which is why there's additional money coming to Wyoming under Graham Cassidy. It will be easier to afford under Graham Cassidy than they can do now under Obamacare, where rates are supposed to go up again next year by a huge number. They're talking 30, 40% increases again, whether you have a pre-existing condition, whether you don't have a pre-existing condition. Just being alive in Wyoming right now, you're being hammered with huge costs, and it's all a result of Obamacare, which is why Donald Trump got 70% of the vote in Wyoming. People were absolutely fed up with what the Democrats have done across the country.
Thank you for answering, I guess, about Obamacare. Again, I was asking about Graham Cassidy, but I have a whole other 45 minutes of a show to do, so I'm going to have to leave it here. Senator Barrasso, thank you so much for joining us.
Congratulations on your book. It's doing very well.
Thank you very much. I hope you get a chance to read it. I do appreciate that, sir. Thank you. And come back anytime. I'd love to keep talking about this. Absolutely.
Thank you.
Thank you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.